What's going on, everyone? Welcome back to my channel, and thank you for clicking on this video. For those of you who may be new to my channel, my name is Terence, and I'm a first-year medical student. If you're new, make sure you subscribe and like the video if you enjoy these videos. I'll be putting out weekly videos just like this every single week, so make sure you come along for the journey and subscribe. For those of you guys who may be new to the channel, this is my interview series. We're on now the fourth interview. I'm here with Rahul Bathija. Is that how you pronounce your last name?
Yeah, you got it. You got first time try. Yeah.
Rahul Bathija, and he is a PT student. I've known him since high school. We played against each other in basketball. Then we went to SUNY Brockport together before my one and done basketball career. And then we've been in connection with each other over time. He's a PT student. He's also a strength and conditioning coach. So I just want to let you introduce yourself, Rahul. Just tell me a little bit about yourself. Tell the viewers about yourself, your educational background, and your current passions in healthcare.
Yeah, so like you said, my name is Rahul. Graduated Brockport with undergrad degree in exercise science, kinesiology, minor in bio. Then took a year off, worked in the strength and conditioning private sector for a little bit, got my CSCS, then applied to Stony Brook's program for physical therapy, got in there. So I'm right now in the second-year PT program. So still do a little bit of S&C work and still go to school at the same time. But yeah, so I love playing sports. I love staying active. Love the outdoors. So it's kind of like what my passion was. Wasn't the best athlete, but I always just loved being around that environment and around those people. So it taught a lot about me, about like friendship, teamwork, and discipline, stuff like that.
Beautiful. Yeah, funny story is so when I wanted to get into the healthcare field in high school, PT was on kind of like the top of my list. I think athletic training and PT were on the top of my list, and it was pretty much my first thought, my first love when it came to healthcare. But over time, I spent more time with it, and through research and learning more about myself, I found out that's not what I truly wanted, and what I wanted was to be a doctor. But along those lines, what skills do you think somebody that wants to go to PT school or somebody that does PT has that's maybe different than somebody that wants to go into becoming a doctor in medical school?
Honestly, I think like the biggest thing like that's underlying factor that like PT administration and PT students like don't take into factors is communication. Being able to just have a conversation with people, being a people person, being able to come into like the clinic or hospital wherever you're working and take out all that negative side that's going on with your life, and then just turning a frown upside down and for yourself, and then giving that to a patient. So obviously we know like if you're in PT, like that emotional part takes a big factor into rehabbing a physical or whatever type of injury you have. So if you're familiar with the biopsychosocial model, that's one component, like social, emotional stress that patients that might be feeling. So I think some people who are not the best communicators or don't value that as much should start doing that. I think like the communication is the biggest thing. The knowledge and all the science, everything is going to come through school, is going to come through experience. Mm-hmm. So honestly, just being the best person you can be and being able to relay what you want out of your patients and being able to have that transparency with them.
Right. When did you know that kind of PT was the route you wanted to go into versus just being a strength and conditioning coach, or even going to like a professional school like PA or medical school?
Yeah, so I was kind of like in the same boat with you. I shadowed a PA, I shadowed an orthopedist, and PT. So like I was kind of just deciding between those three. And honestly, like being like an orthopedist, like or just a regular doctor, and PA is really nice. Like have to live a nice lifestyle, good salary. You still get to work with patients, and you're still working within an orthopedic active lifestyle. I just like PT a little bit more because me personally, I like working with injuries that are like long-term ACL, Achilles, or if you even like working with neurological patients like TBIs or stroke patients. So I like kind of like building that relationship with people. So that's why I think communication is one thing, and sticking with people through the journey. So like if you have someone with a stroke, you're probably rehabbing them for at least 6 months, or if you're working with someone with ACL, at least 6 months, or Achilles even more than that. So I kind of just like that day-to-day interaction and working with people.
Yeah, that's definitely something I think that as physicians, we could go into certain areas and certain specialty that give us that long-term care, that longitudinal care. But, even if you are the physician for somebody that's undergoing an ACL you see them pre-op, you see them post-op, but you're not seeing them for another sometimes 3 to 6 months when we're talking post-op care. And where are they spending their time? They're going to PT, they're going to physical therapy, occupational therapy. They're spending time with a personal trainer, strength and conditioning coach. So there's so many different layers to it. And I think that we need to bridge that gap so patients know that there's more to it than just seeing the doctor, because everybody wants to see the doctor, but nobody wants to go to their therapist, or nobody wants to go to occupational therapy or physical therapy after their surgery. They just want to talk to the doctor for whatever reason. From your experience, how do you think the skill set of PTs, like you mentioned, the communication, the day-to-day, the patience of working with somebody longitudinally, how do you think that complements the physician role and, a med student or med school role?
Well, obviously, you got to have communication skills for a med student for any type of healthcare. You got to be versatile in what you do. So I'm sure you've done this before. I mean, I go to school for physical therapy, but before going to physical therapy, I shadowed an orthopedist, I shadowed a PT, I shadowed a PA. So even though that you might not be even in, let's say I might not be in an orthopedic office, I still go learn from orthopedists, or shadow a surgery and see how it's done. It just gives you a different perspective. So keeping yourself versatile, and don't get into that niche right away. So just learning from different people, learning from different aspects, and keeping yourself versatile. I'd say those two big things: versatile and just communication. Just make sure you're always continuing education. Make sure you're always reading, and learn from your peers, and learn from mentors and stuff like that.
Do you think that a lot of your fellow PT students, they kind of just stay in their own lane and say I want to be a PT. I'm just going to focus on what it is to be the best PT possible, and don't really expand, like you kind of mentioned, like expanding your perspective?
Yeah. And I definitely see that, because I think for the public and for everyone, I think PT is just very, very stigmatized. Can't even say the word right now. You go to a PT clinic, you get a hot pack, you do some exercises, and you go on your day, and then maybe do that twice a week or 3 times a week. So even as PT students, we see that, we've experienced that as patients maybe, and we work in that field. So we think that's all we need to know, and we have to perfect that. But let's say you have a complicated case one day, and it's not a muscle issue. Maybe it's a nerve issue that you're not used to. But you could have learned from a neurologist, or you could have learned from an orthopedist who specializes in a neck or a foot. So that's what I mean by just keep being versatile as a student in the med field or as a PT field, because you're not going to be an expert in everything. You're going to be an expert in a few things, and then you learn from other experts in their field. And me personally, you can learn from a textbook, you can learn from a classroom, but there's not a lot better teacher than experience and interact with other mentors and experts.
I agree. I think, like you mentioned, avoiding that recency bias. So the last thing that you learned about is going to be the first thing that you're going to use to treat a patient. So if you're somebody that only deals with musculature, every day, you're going to think everything's a musculature issue. So it's always good to have your mind wrapped around different things, so you have a wide perspective on what's going on. So I think that's so important. And I think that a lot of people need to start having that mindset, regardless of the field that you're in. Even if you're a nurse, understanding the day-to-day life of a doctor, understanding the day-to-day life of a PA will help you be a better nurse, because it'll allow you to integrate yourself into the system a lot easier. There's no doubt that physicians need therapists, and that therapists need physicians to optimize healthcare. Do you think that there is a way to better improve the current model of what's going on in the relationship between PTs and doctors? Let's say, for an example, an orthopedic surgeon might just give a patient a long list of PTs in their area and say, hey, these are the training regimens I'm going to prescribe, and you go out and do it. Do you think that there should be some more bridges built between the profession, or how do you think that it could be better improved?
Yeah, so I think you kind of see that happening right now, obviously. So if someone has a total knee replacement, they'll send them to a PT or give them a list of PTs, and they'll give the PT precautions and contraindications, and they'll kind of work back and forth with that. I think that's happening right now, which is good. Obviously, and like you said, bridging that gap and building that relationship between an orthopedist and maybe one or two PTs, because if you have a surgery, that surgery is just as good as a rehab. And like you said, that you're in an OR room for a couple hours, you see the patient in an office for like 30 minutes, but the PT's with them 2-3 times a week for multiple hours. So that's where, like, me personally, I think like the bread and butter is going to happen. You guys are like kind of like, I don't even know how to give you a perfect analogy. You guys are like the head chef, and we're like the sous chef, and you kind of need like the sous chef to help you fulfill all those orders for that night, right?
Absolutely.
So obviously establishing a good relationship between a PT and an orthopedist. But then like say we're not working with like a surgery. Say we're working with like just someone with low back pain, or someone's working with like just a rotator cuff who doesn't need surgery. That's where I think that the communication is not good at. So if you're not working with like total like research, if you're not working with total surgery with like major precautions, major contraindications, that's where I think that like transparency gets lost, where like a PT does not communicate with someone's orthopedist. Like you might write a script for someone saying, "Oh, right shoulder pain," and then PT might come in and the PT might evaluate them and like, "This is what I'm thinking. Okay, let's do PT." But that PT doesn't call the orthopedist and say like, "Hey, what did you see during your eval? What was he deficient in? Hey, did you do these tests?" So I think some of those can be lost. Some of those conversations can be lost, or even like if a patient's seeing like a specialist, like say like a neurologist, I think I don't really hear neurologists talking to any like PTs for if someone's having a nerve issue,
Right.
I think some of those get lost. And not to ramble, but I think we can improve on that. And obviously with technology and happening, all that stuff, and kind of build like an online platform where PTs or like any health professional can communicate back and forth without getting on the phone. Because I think it can be kind of a nuisance, or people think it's a nuisance, or it's a waste of time, and you're not being able to see so many patients and talk on the phone with other health professionals. So why not just build an online platform where, just for example, a PT can message like a primary care or an orthopedist or a neurologist and say, "Hey, this is what I'm thinking. Shoot me a text back." Or it can be simply as just putting them in a group.
Yeah, that's a very interesting idea. I wasn't aware about that disconnect between the non-operative patients and the PTs. I've always heard, you prescribe them PT. It's just a conservative measure. But I wasn't sure I didn't know that disconnect was there. So that's something that I'm learning, and I'm glad that you brought that to light, because I think that's really, really important. And I think that goes to kind of go back to the conversation we just had, where the bridge needs to be built between all professions. So even like a medical assistant, that could be their role, or a lower tier role, where PA or medical assistant can now, the one that might have a little bit more free time, communicate with the PT. Obviously the doctor has to communicate to them, but that's a lot faster in a quick, 1 second, 20-second conversation. Hey, they need to have a script for this, suggest these things to the PT. That's a lot easier conversation than having to get on the phone and playing phone tag with a PT that's busy and you're busy as a doctor. But even things like technology, I think the more that you implement technology, the more that you can make medicine move forward and make medicine grow. So that's everything I have for you. Is there anything that you want to leave off any of the listeners with, any words of encouragement for aspiring PTs out there potentially, or aspiring med students that are looking to go to professional school?
Just before applying to PT school or before applying to medical school, I think I saw a quote on this the other day. Like, sometimes your passion is not your career. So I was kind of thinking about that a little bit, and I was thinking like, you can be passionate about something that can work for you and you love to do it, but it's another thing to being able to love to do it and care for it for other people as well. So a lot of people, obviously, high school, they're like, "Oh, I want to be a doctor." Mm-hmm. Then after they go through college, they're like, "I don't want to be a doctor." Like, they might like, if they're talking about PT, like, "Oh, I love exercising. I love like stretching. I love staying active. Let me be a PT." But then they realize the type of coursework they have to go through, and the type of grind it is, or the type of work it is on a day-to-day basis. Mm-hmm. It might not be their passion anymore. So make sure, make sure your passion is for you and for your future patients if you want to pursue a medical or any type of healthcare industry.
Absolutely. You got to do it for you, and you got to know that that's what you want. So you test out the waters before you dive in, because once you dive in, there's no turning back.
Yeah, no cap.
Absolutely. All right. So thank you for coming on the show. Thank you for having the conversation. I think it's an important one that we need to have. And I'm going to continue having this conversation, as redundant as it might be. We're going to keep having this conversation and pushing medicine forward. I want to thank everybody that's watching. Thank you for watching. Make sure you subscribe if you're new. Like the video if you enjoy the video. Comment down below if you like these type of videos and if you want more of them. Good luck to everybody in the mix right now. If you're in PT school, if you're in whatever school, medical school, pre-med, you got this, and let's get it.